Did you know that children suffer from depression? What is depression in children? Depression in children is a mood disorder that can cause them to feel sad, irritable, or hopeless. Children often have mood swings. They may feel sad or irritable for a period of time, like after getting a bad grade or a falling out with friends, but after a while they tend to feel better again. Depression is different. If your child has depression, their sadness hangs on for more than 2 weeks. They may also have irritability or hopelessness that lingers. It may affect your child's sleep, appetite, or relationships with others. Depression can also prevent your child from enjoying school, sports, or hobbies they once enjoyed. In severe cases, depression can lead to thoughts of suicide. If you notice that your child has symptoms of depression for 2 weeks or more, talk to their healthcare provider. Although depression is a serious medical condition, it's usually treatable. Types of depression in children. There are a number of types of depression in children. Today we discuss major depressive disorder. Some people call this clinical depression. It's the most well-known type of depression in children. If your child has major depressive disorder, they may feel sad or hopeless or angered so easily. They may have trouble sleeping, insomnia, or they may sleep too much, hypersomnia. They may not want to do the things that once brought them joy, and they may feel disengaged from their family and friends. Persistent, intense feelings of sadness, worthlessness, and loss of interest in daily activities, and anhedonia, lasting at least 2 weeks. Decreased concentration, thoughts of death or suicide, low speech, decreased movement, and impaired cognitive function, psychomotor agitation, increase or decrease in appetite, which may result in weight gain or weight loss, low energy or fatigue. What causes clinical depression in children? Brain chemistry, an imbalance of neurotransmitters, including serotonin, norepinephrine, and dopamine, contributes to the development of depression. Researchers used to think these imbalances were a primary issue. However, recent theories suggest that disturbances in more complex neural circuits cause secondary imbalances of neurotransmitters. Genetics. If you have a first-degree relative, biological parent, or sibling with clinical depression, you're about 3 times as likely to develop the condition as someone without a family history of the condition. However, you can have clinical depression without a family history of it. Childhood development, multiple adverse childhood experiences, ACEs, such as abuse and trauma, are associated with the development of clinical depression later in life. Stressful life events, difficult experiences, such as the death of a loved one, trauma, divorce, isolation, and lack of support, can trigger clinical depression in people who are susceptible to it. Check out the next video on managing depression in children.